let us discuss about the humerus. Now when you take the humerus, see for the two ends, and one end is rounded, so place it upwards, and the second point is see the same upper end head. This is the head should be placed medially because it forms a joint with the glenoid cavity. Now the third point is see for the lower end, we have a big fossa here that is called as olecranon fossa, that should be placed posteriorly. Then with these 3 points you can say this is the left side bone again. Now coming to the features of this humerus, now it has an upper end, shaft and lower end. So upper end, if you take, it is having head, neck and 2 tubercles are there, greater tubercle and lesser tubercle. Now the head is forming a joint with the forming a shoulder joint, and here we have 3 necks are there: anatomical neck, surgical neck and morphological. Anatomical neck is closely in relation with the next to the head only, whereas surgical neck is separating or it is present between the upper end and the shaft. Now morphological neck we can't see grossly, but it is a neck described in relation with the ossification. So we have 3 ossification centers, secondary ossification centers for the head, greater tubercle and lesser tubercle. All these 3 will be fusing at a time, and then later on they have to fuse with the shaft. So that fusion will be taking place until 20th year. So there will be a gap before fusion. So that gap is called as a morphological neck, not seen in these bones. Now coming to the tubercles, greater tubercle and lesser tubercle. Greater tubercle is 3 muscles are attached here: supraspinatus, infraspinatus and teres minor. So these 3 muscles are, we have a mnemonic SIT, sit, to remember this. Now lesser tubercle, there is a muscle, suprascapularis muscle is inserted. Subscapularis muscle is inserted here. Now we have this groove here, also called as a bicipital groove, also called as intertubercular sulcus. Here this is a groove, so it has 2 lips is there. One is a lateral lip and medial lip. So this is a medial lip. Attachment is the teres major, whereas lateral lip pectoralis major. The floor is attached by the latissimus dorsi. We have a mnemonic lady between 2 majors to remember this. Now there is a content is there. The content here are the long head of the biceps and ascending branch of anterior circumflex humeral artery. So this is about the upper end. Now coming to the shaft, if I keep it like this in an anatomical position, actually this is it has the lower end is little bit triangular, whereas upper end is rounded. So mostly the borders are seen clearly in the lower end only. So I will show this only. Now it has 3 borders: anterior border, medial border, lateral border, and surfaces are, because antero-medial surface, antero-lateral surface, and this is the posterior surface. Now I will discuss the muscles attachments only. In total, you have to remember the muscles of the arm. We have coracobrachialis, brachialis and biceps. So coracobrachialis will be inserting into the medial border, that too in the middle part. Brachialis arises from the anteromedial surface, anterolateral surface and the anterior border, that too in the lower part of the humerus. Now we also have on the anterolateral surface there is a V-shaped structure that is called a deltoid tuberosity, and deltoid muscle is inserted. Now I would also like to show you on the posterior surface. Posterior surface, you know that posterior compartment muscle is the triceps only. So triceps has 3 heads: long head, short head, lateral head and medial head. Long head arises from the scapula, whereas the lateral head, now you see this posterior surface, there is a groove here that called as a radial groove. So the radial groove contains radial nerve and profunda brachial vessels. Now above the radial groove, lateral head of the triceps originates. Below the radial groove, medial head of triceps originates. Remember this way on the posterior surface. Posterior surface is for the triceps muscle. Now also this medial border continues down as a medial supracondylar line where we have polenta TVCs attached. Here lateral border is continues down as a lateral supracondylar line where we have the extensor carpi radialis longus and brachioidalis is attached. So this is about the shaft. Now coming to the lower end, you see here it has articular parts and non-articular parts. So this is the articular part where we have so now you identify this is the one which is projected medially, that is the medial part. This is, so we have medial side bone in the forearm is the ulna. So ulna articulates here with the trochlea here. This is the trochlea, and the radius on the lateral side bone which articulates with the capitulum. So this is capitulum, this is trochlea, fully shaped structure. Now we have non-articular parts, that is the medial epicondyle and this is the lateral epicondyle, and we have, this is the coronoid fossa and this is the radial fossa, because when we have a flexion at the elbow joint, the head of the radius will articulate here, or not articulate, it comes and lies in this fossa. So that is what is called as the radial fossa. And here coronoid process of the ulna comes and lodges here, that is what is called as the coronoid fossa. Now we also have on the back side olecranon fossa where coronoid process will come and lodge in this fossa. Now this medial epicondyle have is common flexor origin. So muscles of the forearm in the flexor compartment comes, most of them will be originate from there. Now on the posterior side there is a relation called as ulnar nerve is related on the posterior surface of this medial epicondyle. And similarly on the lateral epicondyle, this is a common extensor origin. Now on the posterior surface, anconeus will be originated. So this is about the humerus.